During the initial stage, I did a lot of research. I called you. You came on board. It was not easy. I want to thank everybody that today we are all excited, all of us, that we are going to harvest whatever we planted some few years ago. Thank you.
Asante sana Mheshimiwa Mbono. I would like to now invite Dr. Oluga to take us forward to the next phase of the program.
Waziri Mheshimiwa Mutahi Kagwe, the Deputy Director General, our beloved woman rep for Nairobi, Committee Chair for Health, the partners represented by UNICEF Country Representative and the Country Director Amref, our good friend Odede. We've been meaning to meet in Kibra. Now we meet here. Mine is to welcome you, Waziri, to this auspicious occasion. Hawa watu ambao wako hapa ni community health workers na wamekupenda sana. More than 2 weeks ago, nilikuwa nao pale Lang'ata, si ndio? Nikawaambia waziri utakuja, na mimi ningependa kushukuru sana on their behalf kwa sababu umeitikia wito wao na umekuja. Si niliwaambia waziri atakuja? Amekuja ama hajakuja? Si ndio? Sasa sisi tungependa sana kuwashukuru for that, for supporting the community health work, and especially because waziri, some of them have met you before in several locations in Zimmerman and also there in Lang'ata when you are launching the services. We are very proud as the Directorate of Health in NMS to have achieved this objective. We want to thank Bwana Pius who sponsored the bill. We want to thank the CEC Health. We want to thank the County Secretary and the county leadership, because within a very short time, the bill had been lying without gazettement, and within a very, very short time, Waziri working with the County Secretary and our good friend Warutere, who is the committee chair, we gazetted this bill in a record 7 days after it had been on the shelf for almost 2 years. And beyond this act helping the community healthcare workers to get a framework to be motivated, to be paid a stipend, to be remunerated, it also helps us as NMS to make them accountable, because wakati mwingi waziri wakienda pale kijiji vile ulikuja na sisi pale Kibra wakati wa polio, hao ndio walikupeleka waziri when tulikuwa tunafanya chanjo. Na ni muhimu sana wananchi wajue huyu ni community healthcare worker na amepewa tag, amepewa identification na serikali. Ndio tusipate pia wale ambao hawana recognition ama wale ambao wanataka kudanganya wananchi. So beyond ile wanataka kulipwa, sisi pia inatusaidia kwa sababu inafanya kazi yetu iwe rahisi ku identify katika ward ya Kibra ama sub-county ya Kibra ama Lang'ata. Tuko na ile orodha ya wafanyikazi wa afya ama CHVs ambao tunaweza sema hawa ndio wetu, so that if anything goes wrong, kwa sababu waziri hawa wanaenda mpaka kwa households ya watu. So it is very important that we are also accountable for them, and that they are doing the correct thing, that they are well trained, that they are disciplined, that they are not the cause of other issues in the community. Mine, Waziri, is to thank you very much for coming and to thank everyone for coming and to thank you for the work ambao mnafanya, na sisi tutaendelea kufanya hiyo kazi. Kwa sahihi, kwa sababu ya muda, ningependa kualika County Commissioner pia aseme nanyi kidogo, alafu tuendelee na program.
Thank you, Director. Our chief guest, Mheshimiwa Honorable Mutai Kagwe, the Deputy Director, NMS, my brother Kangeza Zuku, Women Rep, Nairobi, Honorable Pasari, the Chairman of the Health Committee from the Nairobi City County, the Secretary, the Nairobi City County, Dr. Musumba, all my colleagues, civil servants present here today, community health workers, habari ya asubuhi. Na wasalimia habari zenu, afya yetu, jukumu letu. Asante sana. Niko na furaha sana kuwa hapa siku ya leo, kwa sababu kazi ambayo hawa ambao wamekaa mbele yetu hapa waziri ni muhimu sana. Tangu mimi nikiwa mtoto mdogo nimeona wakifanya kazi na wanafanya kazi muhimu kabisa. Wakati niliona ile act last week, wakati niliambiwa kwamba tutakuwa na mkutano huu, nikaona kwamba county government imefanya kazi nzuri sana, na ningependa kuchukua nafasi hii kuwashukuru wote ambao walihusika kuwa na hii sheria, ili kazi ambayo mnafanya iwe inatambulika katika sheria za county, niweze kupewa kitu ambacho pia kitawamotivate kufanya kazi ambayo mnafanya, na pia mwe accountable, kwa sababu kuna wengine ambao labda hawafanyi ile kazi ambayo inatakikana, lakini tukiwa na hii sheria tunaweza tukajua ni nani ambaye hafanyi kile ambacho anafaa kuwa akifanya. Nimeona ya kwamba tukiwa na hawa wote kazi yetu itakuwa rahisi, na ningependa kudhibitisha hapa mheshimiwa ya kwamba wakati tulipata hii ugonjwa wa COVID hapa Nairobi, hawa wametusaidia sana, kwa sababu watu wengi wakiwa wagonjwa kwa vijiji, hata wengine hawakuwa wanajua shida ni nini, na wamefanya kazi kubwa sana, na ningependa kuchukua nafasi hii kuwashukuru sana na kusaidia serikali. Mmetusaidia sana kuweza kuattain one of the big 4 agendas ambayo ni kuattain healthcare, na muendelee na hiyo kazi nzuri ambayo mnafanya. Ya mwisho ningependa kutoa hakikisho langu hapa ya kwamba national government itafanya kazi pamoja na hawa, kwa sababu nimeona kwamba machief watakuwa mmojawapo wa komiti ambazo zitakuwa zikifanya kazi kule mashinani. Ningependa kuhakikishia ya kwamba national government iko tayari kufanya kazi na nyinyi kuhakikisha ya kwamba tumeattain universal healthcare katika nchi yetu. Nikimalizia, ningependa kuwakumbusha ya kwamba tumeanza kwa ruhusa yako waziri, nikubali niseme ya kwamba tumeanza kuandikisha wapigaji kura. Najua joto la siasa limeanza. Tafadhali mjulishe wengine kwamba kuanzia leo wale ambao hawana kura wachukue kura zao. Vile vile tumeanzisha program ile tunaita crash program, ili wale vijana ambao hawajachukua vipande waweze kuchukua vipande, ili pia hawa waweze kuchukua kura, ili waweze kupiga kura mwaka ujao. Tutakuwa tukiwa na mobile registration programs katika Nairobi. Kwa hivyo mkiwasiliana na machifu wenu mtaweza kujua mahali ambapo tutakuwa tukipeana vipande. Ya mwisho pia ningependa kusema kwamba tunaenda kuanza phase 2 ya kupeana huduma cards. Wale ambao hawakuweza kuchukua huduma cards tutawapatia hivi karibuni. Kwa hivyo tujulishe watu wetu, na wale wengi, nusu ya watu ambao wako hapa Nairobi waliregister for huduma card na hawajachukua. Ni mwito wangu wale ambao waliregister, tafadhali muweze kuenda kwa ofisi za DCC muweze kuchukua kadi zenu. Na mwisho kabisa ningependa kusema kwamba tukishirikiana na ofisi ya mheshimiwa GAF na NMS tuko na ICAM ambayo imeanza leo. Screening yake inaendelea katika zile hospitali ambazo zimefunguliwa juzi. Tutakuwa tukifanya hiyo screening ili wale ambao watapatikana na ile ambayo inaitwa cataract waweze kufanyiwa surgery bure kuanzia tarehe 14. Kwa hivyo tujaribu kueleza watu wetu waende kwa zile hospitali ambazo ziko karibu waweze kufanyiwa hiyo screening. Asanteni sana kwa kunisikiza.
County Commissioner, sasa ningependa kualika mama wa county Mheshimiwa Esther Passaris akuje waseme kidogo.
The CS Health, the Deputy Director General NMS, the County Secretary of Nairobi County Government, UNICEF, the CEC for Nairobi County Government, my County Commissioner, Dr. Omar Oluga, all protocols observed, the sponsor of the bill, appeals, as well as the chair of the Committee of Health at Nairobi County, my CHVs, Hamjambo tena. CS, I really decided to come here today because this is an important landmark day for our country. The fact that we are actually recognizing through law, through law, the work and efforts of the community health. I don't want to call them volunteers because from today they become workers. Sindio? Munaitwa workers sasa. Sindio? So I don't want to call them volunteers because we have taken advantage of these hard-working Kenyans who started universal healthcare in the grassroots. Universal healthcare ilianza na nyinyi. Nyinyi ndio mulianza kwenda door to door, mukipeana polio, mukipeana education, mukitoa wagonjwa mukiwapeleka kwa hospitali, with their own might, with their own finances. Mumefanya kazi. Nataka kuwapongeza sana by community health workers. Leo ni siku yenu. And Nairobi County Government, together with NMS, what you have achieved today, together with the mover and sponsor of this bill, together with the health committee, from the previous government to the current one, to now last 7 days, when we work together, we work with vision, we can achieve anything. Because something that has been sitting, gathering dust, was moved within 7 days. Now this is what we have to give a big clap to Lieutenant General Badi. He has brought the military discipline into how we do things. Ukienda kwake umwambie tunataka kufanya hivi, Lieutenant General Badi says, this, let's get it done. He looks at it as war, and we have to win the war. So he's not here today. He traveled on work to the US, but he sends you all his greetings and his blessings as you move forward as employees and workers of the Nairobi County Government. I also want to bring you greetings from the governor, acting governor N. Kananu, who also traveled to the US, and she said to tell you she is standing with you and she's supporting you. And I know this is a money bill. We will need to find the resources. If we don't have resources, let us not cost our resources for the community health workers. Let us budget for it. Now I also bring you greetings from my party leader, Raila Amolo Odinga. Munapokea? He went to Garissa today. But he told me if he was not in Garissa, he would have been here. Because he knows the agenda of the president for universal health care is very, very important. And he knows we cannot achieve universal health care without the support of the community health workers. From my office, GAF, during the pandemic, CS, we tried to look for how we can connect with the community health workers. because we wanted to give them money, and we gave them 3 million shillings spread to 30 registered groups. But the thing is, we do not know how many of the groups were genuine, how many were Wakora. And that is because of lack of data. So we need to make sure that we have a platform where you can know, it's not just the uniform and the card. Wajua watu wanaweza kutembeza hii uniform haraka town. Waanze kutembea kwa mtaa waseme mimi community health workers, waanze kuibia watu, waharibu sifa zenu. So we need to find a way beyond the uniform, beyond the ID card, on a well-documented app or website where somebody can quickly Google or send a number and say that is this my community health worker? Is this the person who I should be consulting? Because if we don't do that, then we will fail to help the genuine community health workers on the grassroots. Kama wewe uko huko chini na unataka kufata hii kazi, go through the training, go through the understanding, and then be allocated your area. We have Nyumba Kumi, we have Huduma number, we have a way of working, and that structure should be known and disseminated through a lot of advertising, a lot of public participation, a lot of civic education, because if we don't do that, we will fail. I, for instance, have 2 victims that I'm helping right now. There's a young boy called Shadrach who is paralyzed from neck to bottom. Paralyzed completely. He had an accident, he's completely paralyzed. He goes through tremendous bed sores, a lot of pain. The mother cannot anymore lift him because he's now almost 18. This is where we need the community health worker to be assigned to that boy to be able to help that mother. Now, when you assign a community health worker to a family, and it is a job that requires 2 or 3 visits a week, we have to look beyond the standard stipend. The standard stipend cannot work. I have a burn victim in Kayole right now. A little girl who got burnt, she fell into a pot of oil. She got burnt her whole body. I ended up going to that house. How do I find the community health worker for that particular house in Kayole to be able to go? So we have to find a way to assign. I was in the UK when I saw the community health workers and how they work. In the UK, you have people who are old, and they cannot light the heater on their own. They cannot know, and they lose a lot of people during the cold winter season. So they have such a standard way of working that a community health worker knows everybody in the area who has cancer, who has diabetes, who has hypertension, who has physical disability, who requires assistance even with food or with vitamins or with medicines. And that person is allocated the jobs. So we have to go beyond the law, and we have to recognize that our people are suffering. Our people are suffering. They don't know how to get help. A mother with a disabled child is reaching a point of exhaustion and mental depression, and she needs help. So these are the people who can help. And for us to get them to help, we need to be able to allocate them assignments. And you are paid according to the assignments you've been given. Because if you're going to say, we're giving you 2,000 for instance, and then you expect them to look after 500 people, it's not possible. It's not possible. So, kitu nataka kuambia, wajua mumejitolea kufanya hii kazi, na mumefanya miaka nyingi bila kulipwa. Na hii kazi mumefanya na roho yenu safi. Muendelee hivyo. Wale ambao wanataka, the UK is looking for nurses. The UK is looking for nurses. Wale ambao wanataka kurudi shule kusoma, please apply for bursaries for my office. We sponsor you. Serious. Is there a way that we can look at the qualifications of these people here, the community health workers, and see those who can be sponsored? Because hawana pesa ya kulipa. Mimi nikipatia 10,000 hawawezi kwenda shule. Is there a way that our government can give them scholarships to go and study? Full scholarships. So that they can elevate, alafu UK wakisema wanataka watu kwenda kusaidia huko, they can go, they can get exposure, they can get training, they can come back and serve our people. So there's a lot more than just launching a law. There's a lot more than just launching a law. We have to deliver universal health care, and we cannot without these community health workers. County Commissioner wangu amesimama hapa amezungumza habari ya iCamp. Bwana CS, I'm so proud of you. We are bringing doctors from Spain together with MMA Charitable Trust. They're going to spend over 100 million to perform 500 surgeries of cataract for our people for free. We are working with NMS, Dr. Luga and his team, and we are trying to make sure that we can identify the right people. Today, we're doing the screening in Kariobangi North Health Center. The operations will be done in the 2 hospitals opened by His Excellency. The screening is happening right now, but we need to go mashinani. Tutafute wale watu ambao wako na shida ya macho, blood vision, na waende wafanywe screening ili kama ni cataract wafanywe hiyo operation. Na wakifanywa hiyo screening, we will know through the data ni nini ingine inawasumbua, ili tuweze kuplan how we can bring expert doctors to be able to work with our teams and to be able to do medical camps. Medical camps will help our people. 500 cataract operations for free conducted by the Spanish doctors that are going to come will help also our people learn so much about the new technology. So I really hope mkitoka hapa leo, tafadhali wale mnajua ambao wako na shida ya macho, angalieni, we will share with your platforms, angalieni pale tutakuwa na screening, mtume hawa waende wafanye screening, mufike hapo mfanye hiyo kazi, kwa sababu nafikiria mnaanza kulipwa kwanza mwezi huu, si ndio? Hii ni mwezi mpya, si ndio? So kama mtaanza kulipwa kwanza mwezi huu, anzeni kufanya tarmac. Let us make sure that this eye camp is a success. And Bwana CS, also drugs. We get a lot of people who want to give us drugs for free. So can we find a way? I know government is looking for money, but when people want to give us things for free, whether it's medical camps, whether it's drugs, tuache mambo ya maduty ili vitu ingie tusaidie watu wetu. Because if we put duty, if we put things, you know, I saw HIV drugs being stuck in the airport for so long because of controversy. What we need then is to find a way to work the way Lieutenant General Badi works. Within 7 days we can do it. We can do it within 24 hours. We can do it within 48 hours. We should stop this thing of doing things over a long period of time. So office yangu iko open. Wale ambao wanataka kusoma, let us get the data. Then we talk to the various arms of government. We send these community health workers to school so that they can elevate their education, because in life, wajua Mungu amesema binadamu ni kama mti. Ukipanda mbegu, ukitaka hiyo mti ilete matunda, lazima uendelee kuiweka fertilizer, weka maji, kuichunga, kuzungumza nayo. So we are forming a relationship. I want to say we love you very much. Continue the good work that you're doing. Mko na CS ambao amewapenda, ndio unaona amekutoka ofisi yake amekuja hapa. And COVID vaccinations, I hope all of you are vaccinated and you're going to encourage our people. You know, there's a problem in COVID vaccinations. Watu wanaoga. How do we tell people to stop being scared and to go and get vaccinated? We need the uptake to go higher. So please, start with yourself. Make sure if you're not vaccinated, you get vaccinated, and then encourage others to go so that this country can move forward properly. Asanteni sana, Mungu awabariki.
Afya yetu, jukumu letu. Hiyo kura ya Esther Passaris mtanigawia kidogo. Asante Mama County. Waziri, tunakaribia sasa mwisho. Karibu tunaita County Secretary ambao ataita Deputy Director General, alafu wewe mgeni wetu wa heshima utatuambia, na tungependa sisi kushukuru wewe. Leo we have invited you here because of happiness, not because of problems, because of the policy directions that you've given us, Waziri, and because of the support. Waziri, mingi imesemwa. I just want to take this opportunity to recognize the health team. I would like the senior health management team just to stand up and say hi. Waziri, they work so hard. We have our deputy director, Dr. Musa, who is the one in charge of all the hospitals and the health center. We have deputy director, health for policy planning. Na amesha propose 350 million for next year's stipend. Na sasa vile Bwana Sisi alisema atasukuma, sasa sisi tumeshafanya yetu. We have also Dr. Ngunu was around, who is the one in charge of preventive promotive services. We have the division head, Dr. Kibe, just say hi, Muli. We have Susan. We have Judy. Judy is the one that is in charge of the community health strategy, and we have very good data about community health strategy. Waziri, we have also the sub-county teams. I think that is enough. Thank you. So ours is again to continue thanking you for that and to thank the team who are working so hard with the community health workers. Waziri, as you know, when we were doing the polio vaccination, out of 3.5 million children that were vaccinated in the whole country, 1 million was in Nairobi. The WHO will confirm to you that we surpassed our targets we actually achieved 101%. And you know, at some point they were thinking that we had cooked the data. So they went on a verification. Na hiyo ndio kazi hawa community healthcare workers wamefanya. Wakati wa measles pia tumesurpass target yetu. Kwa sahi waziri, because of your support of vaccination to Nairobi, we also have done a lot of outreaches because that is the best way we found vaccines moving, Waziri. So thank you very much for that support. We have partnered with a lot of people. During the initial days of COVID-19, we did what is called Wheels for Life, which was a program to get women who are pregnant who are going to the hospitals. And we did it in partnership with Bolt. And it was even recognized by WHO because of as one of the innovative ways of mitigating effects of the COVID-19 pandemic, because during curfews, the informal settlements are insecure, the ambulances may not go in. So we had partnered with the Bolt because they have riders. Na our CHVs walitusaidia sana kwa sababu walikuwa na company yao wamama wazito to hospitals. And because when the rest of the other health facilities, especially the private, the antenatal rate was going down by 40%, the consumption in the public sector and utilization was going up in Nairobi by 40% because of the community health workers. So waziri wamefanya kazi mingi sana na we also want to thank them very much. So today is a very good day for them. And even now, because of the health facilities that we have opened, the eye camp that is going on, we've even had other partners such as Hava, ambao wanasema mama na Hava pia wanasafirisha saa zingine. Tuko na wagonjwa ambao wanakuja hospitali, especially wa mama, na kwa sababu maternity is completely free, sometimes they don't even have fare to go home. So you want to discharge someone from the hospital, but hawawezi enda nyumbani, itabidi tena watu wachange. So we have organizations that are helping us, and we have including the Wheels for Life. Now we have Hava that is also agreeing to do sponsorship for those mothers who want to be taken home for a whole month. So we continue to partner with the community healthcare workers to have these innovative ways. We are now doing the NHIF bio-registration. Waziri, out of the 326,000 households that were registered, 66,000 of them have already been enrolled into NHIF. And now with the Office of the County Commissioner and ourselves, pia tunaomba kama CHVs wanaweza pewa hii kazi ndio iende haraka zaidi, hii ya biometric registration. In Nairobi, we have trained them digitally. This program was used by the World Food Program, and it is certified by the Ministry of Labor, Social Protection, Social Services, and it is the one that we have used. Vile County Commissioner alisema, we have used it to identify families that needed cash transfer. So with those very many remarks, I want now to invite Waziri Majevdia to to invite the county secretary, who in turn will invite the Deputy Director General and yourself, Waziri. Thank you. Afya yetu, jukumu letu, asanteni.
Dr. Luga, I now wish to call upon our CS, County Secretary, Dr. Jairus Musumba, to give his remarks and those of the Governor.
Afya yetu, jukumu letu. Waziri wetu wa afya Bwana Kagwe, Deputy Director General Bwana Kang'embe Tuku, mama wa Nairobi Esther Passaris, waziri wa afya Majevdia, representative of UNICEF na wengine wote ambao tumewaheshimu, na wasalimu kwa jina la Yesu. Habari zenu. Mimi hapa sijui nitasema nini kwa sababu mimi
siku ya leo si yangu, ni siku ya guest of honor ambaye ataongea baadaye. Nimetumwa pia na gavana wetu, kaimu gavana wetu ambaye anaitwa Ann Kananu, na akanipa speech yake hapa niweze kusomea ndio muweze kujua hata kama yeye ako kula ameenda ako na sisi hapa. Angetaka sana kuwa hapa, lakini kazi imetokea kwingine ambapo ni lazima aende, na akanipa speech yake niweze kusoma. So nitaweza kusoma nikinukuu vile ameandika. The Cabinet Secretary, guest of honor, Director General ambaye angekuwa hapa but represented by the Deputy Director General, partners who are here, all distinguished guests, ladies and gentlemen. It should have been good morning, I think it is good afternoon now. It is a great pleasure to be part of this launch of the Nairobi City Community Health Services Act 2019, an act of the County Assembly of Nairobi which gave effect to the provisions of Article 43, Section 1A of the Constitution of Kenya, and to provide for the establishment and delineation of community health units within the county for effective and efficient delivery of community-based health services and for connected purposes. It took 4 years, they have already talked about this, of hard labor and lobbying partners and the County Assembly Health Committee led by Honorable Waruteri for this bill to be enacted into law. Therefore, today marks a special day as we officially unveil this document that will work towards improving the health and well-being of Nairobi residents, which is critical in achieving universal health coverage,
quality and efficient basic health care services at the community level. Community health volunteers, mama wa Nairobi amesema sasa youth workers. So community health workers are a big part of ensuring we deliver services to Nairobi residents as they engage in tracing a referral of health-related cases to the nearest health facilities, conducting home visits to determine health situations, promoting appropriate health care for the sick with the support of health partners. Governor anasema we will also ensure an increment in the allocation. Governor amesema pia ile imeulizwa atafanya bidii ndio iweze kuongezeka. My government and staff is fully committed and dedicated to ensuring the act is fully implemented. Amesema lazima itafanyika, and we will make arrangement for the training and certification of health volunteers. Umesikia mama Nairobi akisema, kwa hivyo hata governor wanaelewana naye hapo. I will ensure protection of health and safety of all community health volunteers. Tumesema sasa your workers and community health services personnel in the county, as well as the creation of necessary institutional and coordination framework to encourage and facilitate voluntary provision of community health care services. We will engage the volunteers as well as our own. We will engage the volunteers as our own and use them to reach the grassroots. Kwa hivyo governor anasema anawakubali kama wake. I thank you and bless you. Continue keeping safe. Signed, Her Excellency Anne Kananu, Deputy Governor and Acting Governor Nairobi. Kwa hivyo hiyo ndio speech ya kaimu governor wetu, na kwa sababu ya time nitachukua jukumu hili kumkaribisha Deputy Director General Bwana Kang'ethe Thuku na
This comprises 7,320 community health volunteers and 65 community health assistants as stroke officers. NMS recognizes the work of community health workers, especially in the COVID
COVID-19 response in referring the clients from their household to the 24 newly constructed health facilities in our informal settlement. We appreciate you for promoting health and for good health-seeking behaviors. Waziri Kagwe, our community health workers have managed to register over 326,000 indigent households, out of which 66 households are utilizing NHIF cover. This is no mean a feat. It is not only that they generate
even utilized for World Food Program as they embarked on supporting the vulnerable families through a cash transfer program to cushion them against economic effects of COVID-19 pandemic. Our community health workers have done a tremendous job so far. However, a lot more can be done when a platform is set where NMS is responsible for them and they are accountable to NMS. We have completed vetting our community health volunteers and entered into formal agreement with them to ensure they are motivated through a stipend. We thank the Nairobi County Assembly for allocating 100 million to be used in the initial phase. We wish to request the Assembly to allocate more resources because the 100 million is not enough. And I want to thank them because they have promised to add more. In the past, NMS has paid the community health workers for the indigent registration activity through their link health facilities. And just for that, the activity, we spent about 25 million. I appreciate that a number of development partners are also willing to close the funding gaps for our community health strategy. We welcome the generosity and request that the money is channeled to our community health kitty or FAD so that NMS can assure all our community health workers of equitable distribution. I also appreciate the national government for the policy directives. I appreciate the Nairobi County government for the support in ensuring we have an act in place, and our key partners in community health who continue to journey with us. We are proud of our community health workers and are thankful for their efforts to deliver health care to the most vulnerable in our society. May God bless community health workers. Thank you. Afya yetu jukumu letu. Sasa ni jukumu langu na heshima yangu kumwalika mgeni wa heshima naye aje atuzungumzie. Karibu waziri, makofi. Tena funga, karibu.
Asanteni sana. Please be seated. Thank you very much. Asanteni sana viongozi wenzangu, wafanyikazi wote ambao wako hapa, wageni wote kwa ujumla, hamjambo? Hamjambo tena. Afya yetu jukumu letu. Mungu asifiwe. Sasa mimi wajua sina mengi ya kuzungumza kwa sababu nimeketi hapa kama masaa mawili hivi na zote ambazo nilikuwa nataka kusema zimesemwa. Sasa si mimi vile nimesikia mambo ni machache. Ya kwanza ni kusema ya kwamba tumeshukuru sana na tunafaa kubwa kwa sababu ya kupitisha hii act, the Nairobi City Community Health Services Act. Na nataka kumshukuru Nairobi County Assembly kwa vile mmepitisha hii mswada, kwa sababu it is one thing to depend on individuals and it is another to depend on institutions. You cannot rely on the goodness of man or woman, for that matter, to protect our workers. But in law, once it is in law, then we are protecting our workers through the law. Na sijui kama nyinyi mnaelewa ni kitu gani imefanyika leo hii. Hii kitu mnaona nikishika hapa, this is the Kenya Gazette supplement. Hii ndio sheria yenyewe. Na hii kitu ni muhimu jameni. Na hii kitu itamsaidia nyinyi sana, sana, sana. Kwa hivyo nataka kumshukuru Bwana Pius Mwaura. Congratulations my brother. Mheshimiwa, congratulations. Chairman wako Bwana Warutere, congratulations. Na ujumla Nairobi City County Assembly, I want to praise you and I want to congratulate you for really coming to the aid of our workers, recognizing the importance of our community health volunteers, appreciating the work that they do, kwa sababu hii ni mwanzo mzuri sana. Ya pili ni kusema ya kwamba nyinyi sasa mkitaka kuitwa volunteer ni sawa, mkitaka kuitwa waka ni sawa, mimi ni nani nikatae? Lakini mnajua volunteer, let me tell you, there is something special about a volunteer. This is a person who takes it from their own hearts. Ni kutoka hapa, sio tumbo. Kuna mtu anatoa hapa na kuna mtu anatoa hapa kwa roho. Nyinyi mnajitolea kwa sababu
to see. You know, challenges of the Kenyan health sector. It is people who are not health seeking. So we want to improve on what we are calling the health seeking behavior of our people. We want to make sure that when a person is feeling unwell, they go and see the doctors as quickly as possible. Wale watu ambao wanaweza kusaidia in changing Kenyans so that they develop a health-seeking behavior pattern is yourselves. Nyinyi ndio mnaweza kutusaidia so that somebody with malaria hakai nyumbani mpaka hiyo malaria
zidi, alafu kwenda hospitali is too late. You can identify them yourselves. Instead of a mother going to hospital to deliver and she has been having problems for 2 days, so that the maternal
the people who can help us. Instead of a person at home with that they could have cancer, if we detect it early, we can save that person. But you are the person who can help us to do that. Kwa hivyo nyinyi mna kazi kubwa. You have got a lot of work. Esther mentioned about the UK. I can tell you about Cuba. In Cuba, the community health volunteer is the most important health worker. Sio daktari, sio nimeshida wala kwa kule hospitali, it is a community person. Yule ambao anatembelea kina mama na kina wazee kuangalia huko nyumbani. And going forward, what I would propose on Kagefe when my brother Bandi comes back, one of the things to do is to ensure that all our workers are connected to a health facility.
Kwa sababu saa ingine there is no connectivity between a health facility and a community health worker. What we want to do is that as we register
the health workers, and Bwana Oluga, you are doing a good job. What we would like to see is two things. Number one, if we are registering NHIF people via biometric registration, and to avoid the problem of identifying our community health workers, we should register them biometrically as well. As Esther said, you should be able to go to a computer immediately and see the picture. Unaona huyu ni Judy, ako hapa anafanya kazi Kibera, na huyu ni Atieno, ako hapa, na huyu ni Kamau, anafanya kazi Gomongo, so that we know exactly who it is with their photos and everything. That should be easy. There is nothing complicated about that. Mimi ni mtu wa ICT, naelewa hiyo. It is an easy job and it helps us so much. The second thing is to ensure that the training that we are talking about, sio ile training tu ya siku mbili alafu mtu anaambiwa ingia uwaja. We want you people to be properly trained. Hii training sio training na kupatiwa ka notebook. Hapana, unafanywa training, unapatiwa a smart mobile phone ndio uweze kufanya records, so that when you treat somebody unaweka hapo dakika moja, hiyo data inaenda mara moja kwa Oluga anajua afanye nini. Ama jamani, nyinyi mnaona namna gani? Sio ndio ukweli? Because the world has moved on. Dunia imeendelea. Hii mambo ya big pen na ka notebook na makaratasi ile naona watu wakibeba, hiyo imekwisha. That's gone. So kwa hivyo mimi ningewasihi wale ambao wanafanya budgets, and I want to say a special request to our development partners, and I want to say a special thank you to UNICEF. I know how Manisa has been working, I know how my brother here has been working, but I want us to take it further. We use Nairobi as a pilot project to use our community health workers and volunteers to develop data on all our people and the community at large. And that we can do. There is no reason at all why we cannot do that. But the third thing I also want to propose is that moving forward, you also become our agents of hygiene and primary health care, ile mambo ya usafi jameni. Kwa sababu through COVID-19, we have seen the impact of hygiene and cleanliness. The disease burden has reduced dramatically. Mimi kwanza mwaka huu hatujasikia mambo ya cholera. Kwa sababu gani? Kwa sababu ya kunawa mkono na kuwa safi. That is why. And who has made that happen? Nyinyi wenyewe. Mpigieni makofi jameni. And so we want to make sure that you are also trained in the area of ensuring that communities are clean. Wajua jamani, people don't link. People don't link seeing that in the streets with their health. They don't see the relationship. That there is a direct relationship between uncollected garbage and your children's health. Manake mtu ambaye anawi mkono, let me take you through a small story. Mtu anaenda hapa South France. Anaenda kwa soko. Ameenda show, hajanawa mkono ama chochote. Anaenda anashika mboga. No sanitizing, nothing. Anashika mboga. Wewe mama kwanza he weighs it. Anachoka hii uzito iko namna gani? Anaipeleka kama mpira. Anaona hiyo uzito ni mzuri, basi hapana, hiyo anaacha. Wewe mama unakuja unachukua ile mboga. Unapeleka nyumbani. Kabla hujapeleka nyumbani unamwambia mtoto pelekea hii Wanjiro akupikie. Mtoto anachukua ile mboga. Unaona hiyo picture unaiona? Unaona hiyo hadithi? Anashika hiyo mboga, anaipeleka, lakini kabla hajaipeleka isafishwe ama ipikwe, yeye anarudi kucheza na wengine. Anaanza kula mkono. You can see the picture now,
Sasa yeye hiyo kitu yote ameweka kwa mdomo. Wewe saa hiyo kufika usiku manane, mtoto wako na problem ya tumbo, wewe sasa unaanza kukibizana na mahospitali. Badala ya kulala, wewe sasa uko pale Kibra, ile hospitali mpya tulifungua. Umeingia huko ni saa 8, umezungushwa hapo kidogo, saa 11 unarudi nyumbani. Unaingia nyumbani, unataka uko na usingizi, unataka kulala saa 1 ndio uweze kwenda kazini. Usingizi unakuzidi, ukiangalia saa ni saa 4. Unaenda kazini, umefutwa kazi. Sasa wewe umefutwa kazi kwa nini? Kwa sababu ya yule mtu ambaye hakufanya nini? Unaona hiyo hadithi yetu? So jameni, you must see the link between hygiene and our well-being as a country. And I want you to be on the front line. Community health workers and volunteers na wengineo. Please, we must be on the front line. We must teach our people the relationship between cleanliness and our health. Na ndio sababu tunataka kuanza hii mradi wa the cleanest county in the country, to introduce a cleanliness index, because we have seen the importance of being clean. Hiyo ndio inaweza saidia watu wengi sana sana katika nchi yetu ya Kenya. Kwa hivyo hata wale wako nyumba 10, in addition to security, think of security, think of health as a security issue. Kwa sababu mtu ambaye ni mgonjwa hakuna kitu nyingine anaelewa. Health is very personal. And if the person is not well, if the person is not healthy, other issues do not arise. So health is also a security issue. And our nyumba 10 people should also participate in this. We also want to urge and are working with the Ministry of Education to make sure that the issues of health and hygiene are an integral part of our education at a very young age, because that way we can help our children in the future.
health and hygiene are an integral part of our education at a very young age, because that way we can help our children in the future. Develop a plan. Nairobi has got a very good spread. I know that most of you are trained in this area of vaccinations, so that we ensure that all our citizens, the eligible citizens, have all been vaccinated. That way, by Mashujaa Day, we want to have at least 5 million doses. 5 million doses in Nairobi, around the country, so that we have got 5 million doses that have been used. Then we know we are moving on to herd immunity. We thank God that even though we have kept our schools open, we have not seen fatalities amongst our children, or very few if at all, and for that we are grateful. Lakini walimu is where the rubber meets the road. So we want to make sure that our teachers are also all vaccinated, because it is you who is exposed, and consequently you expose the children. So wenzangu, mimi yangu ni kuwashukuru tu, and to urge, ile mambo nimesikia, kuna wimbo moja nimesikia hapa umeimbwa, hata mimi nilikuwa karibu kuimba, wakasema sisi volunteers tumechoka kuvolunteer. Hapana, hebu nimweleze jameni, there is work and there is a calling. This is a calling. You can never be tired of a calling. Kwa hivyo vile mungeimba ni kwamba tunataka kausaidizi ndio hii volunteering iwe tamu. Hiyo wimbo mgeuze kidogo, mseme mseme sisi wa volunteer tuongeze kitu kidogo ndio volunteer unakuwa tamu. I can even write for you the song so that so that the song becomes even better. Ama namna gani? So my friends, I am asking on your behalf, mimi ni community health worker number 1. Mimi. Kwa hivyo ningetaka kuwasihi all counties as I close my remarks. I would like all counties to pass a bill similar to this one, so that you can be protected, so that we can protect our workers. We pass a bill like this one. The second thing is the same county assemblies, all counties, to pass a bill that leaves all money collected in hospitals, leave that money in the hospitals, so that they can be able to buy medicines. Kwa sababu the experience we have got is that those counties that have passed the bill to allow for money collected from hospitals to stay in hospitals are doing better than the ones who have not. Kwa sababu vile kunafanyika ni kwamba watu wanaenda hospitali, wanalipa pesa kidogo, hiyo pesa inapelekwa county government treasury. Ile ingine inatoka NHIF, pia inapelekwa treasury ya county. Alafu sasa watu wanasema hapa hakuna barabara. Badala ya pesa kupelekwa kwa hospitali kununua madawa, sasa unaona hiyo imeenda kujenga barabara. And I'm all for building roads. Lakini nikiwa naumwa na tumbo, afadhali niende kwa Maram na ndio hakuna siumwe na tumbo, badala ya Tamak ambao naumwa na tumbo natapika. Ama namna gani jameni? Would you want otherwise yourself? So please, let's pass the bills within the county assemblies. Let's pass the bills to protect funds, ring-fence the funds that are for health to stay in health. Pass a bill to protect our community health workers and to institutionalize their work within the counties. Ukifanya hizo, and finally
hawa watu jameni walipe. Pay them so that they can be enthused, so that they can be encouraged. As a national government, I promise you, we are going to do everything that we can to ensure that that is the case. On the issue of training, again, I want to respond.
Kabisa.
Wajua kuna watu wanataka kusupport wajua wanataka kumwambia. Kwanza mambo ya pesa kuna watu wataki niseme. Nitoboe. Unaona wamerudisha kwa sababu yenu. So kwa hivyo what I want to say is that the training, indeed it is true, we have signed an agreement with the government of the United Kingdom so that they can take our extra health trained nurses. We have also in the process of signing agreements with very many other governments, not just for nurses, but for extra workers that we have got in all fields. My focus is health, but there are some others. For example, the UK is looking for truck drivers. Na hapa unafikiri hatuwezi kuwapatia truck drivers. So as a policy, the government is intent on creating opportunities as we can for our young people and for our workers in this country. So the training, Mheshimiwa, that you refer to is crucial. And I agree with you that we must find a way of ensuring that our community health workers and volunteers are also part of that process, so that those of you who are qualified and can train up can go and work in the UK and elsewhere. Kwani nyinyi hamgependi kupatiwa pounds instead of shillings? Si ndio? So we work closely with the county governments to ensure that we create opportunities and we give as many opportunities to as many people as we can. Kwa hivyo machache, I want now to declare the launch of the Nairobi City Community Health Services Act 2019 officially launched. Sijui kama naona naitwa huko, nikuje huko. Lakini tuko pamoja jamani. Are we together? Na hii kitu hata nyinyi, when you are protecting people, you also protect yourself. Kwa sababu nilisema you can get it. Can you get it? You can get it. I can get it. And if we treat this disease normally, it will treat us. Asanteni sana.
Tusonge nyuma kabisa kwanza. 1 2 1 2 1 2